Good day everyone and welcome back to my channel. I'm Gwendolyn Hale, a seasoned medical professional, and I'm here to bring you the juice. Today we'll be talking about what does a penis taste or smell like, or what is the taste or smell of a normal penis. But before we dive into our teaching for today, if you're a returning subscriber, this is me saying thank you. Thank you for your comments. Thank you for sharing. And if you just stumbled on this channel, this is me saying I love you. Don't forget to subscribe, turn on the notification bell, and share as well. Let's roll in. Welcome back. Into this class, we are going to be talking about the taste and smell of the penis and semen, or how should the penis or semen taste and smell. A healthy penis, of course. Now, the first thing I want you to know is that semen is made up of sperms, some minerals, some proteins, and some enzymes. And there are two types of discharges that often occur in a male, especially during sexual activity or during sexual arousal, and that is the precum and the cum. The cum is the semen or the ejaculate. So it is very important that we understand that all these ejaculates, the precum and the semen, do have the same characteristics. That means they do have the same smell and the same taste. It's very important. Now, the only difference between the semen and the precum is that the precum may not contain as much fluid or may not come out in a large amount as the ejaculate or the cum, and it also may contain a small amount of sperms, while the ejaculate or semen contains larger amount of sperm. So this is very important. Now, the smell or the taste of a healthy penis is unique for each individual, and that would depend on their lifestyle, their hygiene, and also what they eat. Now, some men may have a fishy smell, salty taste, some may even have some kind of sweaty taste or smell. So it's different from each individual, for each individual. Now, what is the taste of a penis or of a semen? Semen would taste a little and smell like chlorine, ammonia, or bleach. Now, have a picture of a hospital, a swimming pool, or like a laundry room, or where they go to launder clothes, a laundrette. So that's an example of how the penis or semen should taste and smell. Another thing I want you to know is that the pH of semen is between 7.2 to 8.2. That is the potential of hydrogen. It's slightly alkaline, and that is why it falls within the range of ammonia, bleach, and chlorine. The semen and the precum are slightly alkaline in pH. The precum is slightly alkaline so that when it goes into the vagina, it neutralizes the pH, that slight acidity, and makes it a comfortable environment, a medium for the sperm to swim rapidly to the cervix, through the cervix into the womb, and fertilization will occur. It is also important to know that eating lots of vegetables and fruits can actually reduce the smell and taste of the chlorine, bleach, and ammonia that is smelled or that is tasted in the semen. So if you are a male and you want to reduce that chlorine or ammonia or bleach smell and taste, you can consume more fruits and more vegetables. It's going to help you a lot. I also want to say that if a male isn't hygienic, especially for some males that are uncircumcised, there's most likely to be an accumulation of dead cells and sweat and microorganisms, underneath the foreskin. And that may lead to the production of smegma. Now, if smegma is accumulated there for a long period of time, or if that male doesn't wash his penis properly, in that I mean that if he doesn't pull back the skin of his penis so he can wash underneath the foreskin, that accumulation of smegma can lead to balanitis. And trust me, it's going to cause an awful smell. It's going to cause the penis to smell real bad. It is also important to note that when a male has a sexually transmitted disease or urinary tract infection, it affects the taste and smell of the precum, the semen, and the penis. So it's very important that men should actually understand their bodies. As a male, you should be able to smell and even taste your precum or your semen to even know the consistency, of your precum and of your ejaculate or semen. Don't be naive about certain things concerning your reproductive health or sexual health. Also examine yourself. Touch your semen, touch your precum, see if it's changed, if the smell has changed. You see if it's awful in color, the color has changed. The normal color of precum or ejaculate or semen is normally off-white. So if you notice the color going a little bit different from what off-white is, then I think you need to see your urologist. Thank you so much for joining me in today's class. I remain your seasoned medical professional, Gwendolyn Haller. Bye-bye.